I've had the privilege and pleasure of working with the finance team over the last year. They're a team of consummate professionals. They work in a highly complex world of a number of different types of disciplines. They have to provide clarity for managers and clinicians about where we are. I think they're a bit like the navigators of the ship. They tell us where we are so that people can make the right decisions.
In the 18 years I've been a finance director, this is the most highly performing financial accounts team I've ever worked with. Not only for their technical experience and technical expertise, but also their appreciation and understanding of the wider work that goes on within the organisation.
They've had a major role to play in the last year in terms of consolidating the accounts of the Spencer wing, where private patient income is important to the Trust. And they've done that really well. They've done it very quickly, they've done it very accurately, and they've done it according to our external auditors to an exceptionally high standard. They also look for opportunities to improve their own performance. And this year alone, through very effective management of our investments, they've exceeded the targets that they were set in terms of the return on our investments. That's money that goes back into patient care.
Coordinator's office, Claire speaking.
Originally we worked across 3 sites, so there was a cancer care coordinator, 1 on each site. Obviously we've got different numbers of CNSs on each of the sites, so it became apparent quite quickly that some of the cancer care coordinators were dealing with a much higher level of calls than the other 2. So in order to provide equity and also a way that we could make sure that the phones weren't constantly engaged when patients were trying to get through, we set up a centralised office. We currently receive about 1,500 to 2,000 calls a month from cancer patients, and the cancer care coordinators actually deal with about 30% of those calls themselves. So that's around anywhere between 300 and 600 calls a month. So obviously this is a really good way to use the resources of the more skilled clinical nurse specialist. It then frees up their time to do the more important things that they need to do.
With this cancer care line, they're getting through to somebody who's knowledgeable about the cancer pathway, and sometimes it's just them phoning up because they've forgotten about their outpatient appointment or whether chasing a scan, and the staff on the cancer care line can often sort that out, so they don't actually have to contact a clinical nurse specialist. We've seen our workload much more streamlined and much more efficient.
As far as I'm aware, we are the first in the country to operate this service. But we have been working with Christie's in Manchester and also Imperial College London, who are intending to take on our model of service.
I think one of the main reasons I nominated Clarke Ward was because how they all gel together as a team, and I think a lot of people don't actually appreciate the amount of patients that actually come through Clarke on a day-to-day basis, and that every single patient is treated as an individual.
This ward's really friendly and the staff are very nice, and we just all work really well together. Every day we have a different amount of patients coming in and different amounts of discharges. Everybody's having maybe slightly different operations, so not one person can be treated the same.
What Clarke Ward has taught me is basically to treat each of the patients as individuals and always, take into account what their needs are. Make sure you assess them before you go into their notes, regardless of what it is. Make sure you're listening to them, because, just like customers, they're always right.
They too take on the new innovations. We have had the Da Vinci robot, and they took to that very well, and they've looked after these patients. But I think it's really just how they treat their patients with such dignity and respect, and I think they really do need to be recognised for that.